Greetings, health buddy. In this video, we'll talk about how tight affects hyperthyroidism. When your thyroid gland generates too many thyroid hormones, the illness is known as hyperthyroidism. Graves' disease is the most prevalent cause of hypothyroidism. It affects 4 out of every 5 Americans with hyperthyroidism. 1% of Americans over the age of 12 suffer from hyperthyroidism, a prevalent ailment that results in bothersome symptoms like lethargy, sleeplessness, heat, sensitivity, unsteady heartbeat, unexpected weight loss, inconsistent bowel motions, bulging, and trembling. Why is tying crucial for treating hyperthyroidism? A crucial stage is modifying your diet to enhance or decrease your intake of specific foods, nutrients, and minerals to control hyperthyroidism. Here are some foods to avoid with hyperthyroidism, starting with iodine-rich meals. The foods we eat can affect the release of thyroid hormone and thyroid functioning. 1. Iodine-rich foods. Foods high in iodine. If ingested in excess, iodine encourages the thyroid gland to release thyroid hormones, which worsens the symptoms. Foods high in iodine include seafood, especially shellfish, and egg yolks, dairy ingredients, kelp or algae, red meals, indigo, molasses, salts, iodized. 2. Soy products. The second soy product to avoid is soy if you're receiving radioactive iodine therapy to control the synthesis of thyroid hormones. Soy sauce is among the foods to stay away from. Substitute primers made with soy, including as soy-based milk, tofu, and soybean oil. 3. Gluten. Third, since research indicates that gluten hyperthyroidism is more prevalent in those with celiac disease, also known as gluten intolerance, it is advisable to limit the consumption of foods that may contain wheat, such as bread, cereal, cookies, and birthday cakes, as well as soups. The color food protein snacks yeast rye included cold slices with beer gravy fried potatoes. 4. Caffeine. Caffeine is ranked 4th. Avoiding the following foods and beverages if you have caffeine hyperthyroidism symptoms, including shaking, anxiety, problems sleeping, or irritability, is advised. Coffee, normal sodas with chocolate, and guarana-based energy drinks. The following foods are recommended for those with hyperthyroidism. 5. Low iodine foods. Doctor's list of the top 5 low iodine foods. Some patients with hyperthyroidism could be advised to adhere to a low iodine diet that includes foods like non-iodized salt vegetables, especially cruciferous fresh fruit jams or jellies, potatoes, dietary fats, honey, and iodine. A mineral is essential for the production of thyroid hormones. Thyroid hormone production is decreased by a low iodine diet. 6. Selenium foods. Vitamins and minerals like selenium, which are in the 6th place. The mineral selenium may help lessen symptoms like pulsing eyes and the advancement of disorders like Graves' disease that cause hyperthyroidism. You might need to take selenium supplements since your thyroid needs selenium to process its hormones. Nevertheless, some foods, such as Brazil nuts, can aid in selenium absorption. Egg whites, spinach, and oats, bean soup, cereals, and pastas. Other foods high in selenium may also be high in iodine, which may be harmful to the thyroid. These foods include cottage cheese, shrimp, and tuna. Egg whites. To choose the ideal diet for you, you should take a medical expert's advice into account. 7. Iron foods. 7th, iron. Research has linked low iron intake to thyroid disorders, including hyperthyroidism. So it's important to include iron-rich foods in your diet, such as dark chocolate, beef, chicken, spinach, nuts, seeds, and whole grains. Iron foods are also essential for many bodily processes, including red blood cells that transport oxygen throughout the body. 8. Healthy fats. The 8th, fats, consuming a lot of healthy fats. If you follow a non-dairy diet, it is crucial to consume healthy fats. By regulating thyroid hormone levels, healthy fats prevent thyroid inflammation. Flaxseed oil is a good source of healthy fats. Avocado, olive, coconut, and unsalted almonds. Hyperthyroidism can be brought on by a number of circumstances. The most typical cause of hyperthyroidism is the autoimmune illness Graves' disease. In Graves' disease, your thyroid gland is attacked by antibodies produced by your immune system, which causes an excessive amount of hormone to be released. Women experience Graves' illness more frequently than males do. According to a 2011 scientific overview, environmental factors also have an impact on whether someone may develop Graves', but genetics still play a significant influence. Graves' illness isn't caused by a single gene deficiency, but rather by tiny mutations in a number of genes, according to studies of families and twins. In order for your doctor to accurately assess your risk factors, you should let them know if any members of your family have been given a hyperthyroidism diagnosis. Other causes of hyperthyroidism outside Graves' disease include too much iodine. Iodine is a crucial component of T4 and T3, and too much of it might temporarily increase the thyroid hormone's production. Fish and dairy products are two foods that contain iodine. It can also be found in some drugs, including cough syrups, medical contrast dyes, and amiodarone for heart arrhythmia. Thyroiditis, thyroid infection. Conditions known as thyroiditis cause the thyroid gland to enlarge and produce either an excessive amount or an insufficient amount of the hormone. Benign nodules on the thyroid. On the thyroid gland, nodules, which are lumps, frequently form for unclear reasons. Although the majority of thyroid nodules are benign, some do produce excessive thyroid hormones. Nodules are sometimes known as adenomas or benign tumors. Poisonous adenoma, thyroid nodules. There are certain cancerous or malignant thyroid nodules. A nodule's benignity or malignancy can be evaluated via ultrasound or a procedure known as fine needle aspiration tissue biopsy. Testicular or ovarian cancer. Blood has a lot of T4. Certain dietary supplements or excessive doses of the thyroid hormone drug levothyroxine can cause high levels of T4. To choose the ideal diet for you, you should take a medical expert's advice into account. 7. Iron foods. 7th, iron. Research has linked low iron intake to thyroid disorders, including hyperthyroidism. So it's important to include iron-rich foods in your diet, such as dark chocolate, beef, chicken, spinach, nuts, seeds, and whole grains. Iron foods are also essential for many bodily processes, including red blood cells that transport oxygen throughout the body. 8. Healthy fats. The 8th fats, consuming a lot of healthy fats. If you follow a non-dairy diet, it is crucial to consume healthy fats. By regulating thyroid hormone levels, healthy fats prevent thyroid inflammation. Flaxseed oil is a good source of healthy fats. Avocado, olive, coconut, and unsalted almonds